Hello, this is Franklin. Welcome to my channel. Today, I'll be looking at nursing case study Viva Voce. As a nursing student, before you complete and you're given the license to practice, there is a need for you to defend your case study. And most of it are not students may not be privy to the kind of questions that are being asked. So in view of that, I have decided to provide some guidance on how to answer Viva Voce questions. When we talk about Viva Voce, or which say Viva Voce, depending on how people pronounce it, but it simply means an oral examination. So questions are asked, and you have to respond to the question orally. So for nursing case study, it's by oral examination. So for a nursing case student, typically involve questions that assess their understanding or your understanding of the care. It also assesses your clinical reasoning and your ability to provide appropriate nursing care for the patient you are creating the care study on. So below are some common Viva Voce questions for nursing case study, and the aim here is to guide you on how to answer them effectively. So let's look at the composition of the examiners. Mostly there are 3 examiners, 1 clinician, 1 tutor, and 1 invigilator. The invigilator is just to do the paperwork and to guide you into the room, but the main questions are going to be asked by the clinician and the tutor. So mostly questions are asked based on what they have read, but mostly they'll tell you to introduce yourself, or they'll tell you to tell us about your patient. That one is just to calm you down, but the major questions comes from introduction and then background. So the question can be like, can you provide a brief overview of the patient's background and the reason for their admission? So here, in able to answer this question, you need to begin by summarizing the patient demographic information, the medical history, and the primary reason for admission. Here, you need to clearly state the focus of the nursing case study. Now, for the demographic information, that is your patient. You have been with the patient for a number of days, so you should know your patient. So my patient, Mr. AB, he hails from Zoko. He's married with 2 children. Then for the medical history, he came with difficulty in breathing, he came with fever, vomiting, loss of appetite. You wrote the nursing case study. These informations are found in the nursing case study. You should be familiar with them. And the primary reason for the admission. So sometimes if the patient is vomiting, you can't give oral medication for the patient to go home. So the patient needs to be admitted. If the patient is very weak, the patient needs to be admitted. So mostly the reason is the weakness, the vomiting, the need for observation, the need for observed treatment, and the need for other laboratory investigation to be done. That is the primary reason for their admission. But for you, luckily you have written it in your nursing case study, so you should be able to state it. In the area of assessment and data collection, the question can be, what were the key findings from your initial assessment of the patient? Your answer should highlight on the relevant data obtained during the assessment. You assessed the patient. You took the patient's vital signs. You did physical examination on the patient. And also, there were other things that you found out from the patient. You need to emphasize on that. So here, the ability to identify and prioritize the relevant data is critical. So you need to be able to tell us what was the initial vital signs when the patient was admitted. When you did your physical examination from head to toe, what were your findings? Was there any other thing that you find out? You need to tell the examiners. Nursing diagnosis, plural. Here, the question can be, what nursing diagnosis did you identify for this patient? It is in your nursing care study. Know them. This is not the time to diagnose the patient again, but they are inside. They are holding it, they have opened to the place, and they are asking you, so you should be able to state it. So here you have to discuss the nursing diagnosis you formulated based on the assessment of data, and you also need to clearly articulate the rationale for each diagnosis and how it relates to the patient's condition. So there was imbalanced nutrition, less than body requirement related to loss of appetite. Probably there was dyspnea, difficulty in breathing, related to inadequate tissue perfusion. The diagnosis is found inside your nursing care plan. Know them. Setting priorities and goals. Here you will be asked, how did you determine the priorities for nursing care and what goals did you set for your patient? When a question like this is asked, you need to explain the process of prioritization. You need to consider the patient's immediate needs and also the potential risk. And that is where the SMART criteria for setting goals and how they align to your nursing diagnosis. So if patient comes with vomiting, difficulty in breathing, nausea, fever, how will you prioritize this information? Definitely you have to go first and tackle the difficulty in breathing. Then you can come and reduce the temperature by 1 degree Celsius. Then you look at the nausea, the vomiting, the nausea and vomiting. So definitely this is area of prioritization, and which I know it is in your nursing care plan. You should be able to provide the answers for the examiners. Now, when it comes to interventions and care plan, the question is, how or can you describe the nursing interventions you implemented and the rationale behind them? So definitely when you diagnose, you need to intervene. You need to give orders and intervene. So you outline the specific nursing interventions you initiated. Here you need to provide a clear rationale for each and also link the interventions to the specified nursing diagnosis and goals. And here the emphasis is evidence-based practice. So let's assume inadequate nutrition, less than body requirements. And you say that the patient will retain his nutritional status throughout the period of hospitalization, as evidenced by the patient maintaining his weight, the patient verbalized that he can now eat, or whatever. So the intervention, this thing is you need to assess the nutritional status of the patient. You need to plan the diet with the patient. His favorite diet, of course. You need to, there are a lot of nursing orders that you can do. How do you intervene? So patient diet was planned, and he said he liked desserts with maybe plain soup. So you should have the reason behind all these interventions that you give to the patient. If it is fever, the patient fever 38.5 degrees Celsius related to probably the inflammation process of the disease. So your outcome criteria is patient's temperature will be reduced by 1 degree Celsius as evidenced by taking the patient's temperature using a thermometer and it's reduced by 1 degree Celsius as it reads 38.5 degrees Celsius, 37.5 degrees Celsius. And patient from realizing that there is absence or the fever is normal. So so what are you going to do? What are the interventions you're going to? Probably you do tepid sponging. Probably you assess. So basically what we want to know to be able to outline the nursing interventions you initiate. And also be very clear that there are rationales behind each. So let's take, for instance, you have the nursing orders for pain. And saying that you assess and identify the source of severity of pain. That's the nursing order. Then we are saying that you provide education about the cause and treatment of pain. That's an order. Administer analgesics to manage pain is another order. Position the patient in a comfortable and relaxed position, another order. Promote physical activity and exercise as appropriate, another order. Provide emotional support and diversional therapy or distractions is also another order. Monitor and reassess patient response to intervention. So if it's pain and the orders, basically what you want to do is to assess the level of pain. So use the pain scale. Provide education about cause and treatment of pain. So patient was educated that the pain is as a result of this, and we use this medication to treat pain. Administration of analgesics to manage pain. So what medication was the patient on? Was it PMO? So patient was administered with the PMO, the prescribed PMO. So these are the orders and its intervention. Now, evaluation of nursing care. There is also another area that examiners can ask questions you on. So the question is, how did you evaluate the effectiveness of the nursing intervention? So you stated that within 45 minutes, patient's temperature will be reduced by 1 degree Celsius. How do you evaluate it? What it means is that you are going to discuss the criteria used to evaluate the outcome of the nursing care and provide example for the objective data, patient response, and any modification made to the care plan based on the evaluation. So after 40 minutes, the pain, the fever, you need to take your vital signs and see whether the temperature was able to be reduced by 1 degree Celsius. And if it is not able to reduce by 1 degree Celsius, then you have to modify your intervention, your nursing diagnosis, or your orders, so that it can meet your goal. Another area that can be asked, questions can be asked, is collaboration with healthcare team. Here, the examiners want to find out if you are actually collaborating with other professionals. It's not only the doctor and the nurses that are supposed to be taking care of the patient. There are other people or other health professionals who matters in the care of the patient. Are you able to collaborate with them? So here you describe the instances where collaboration was essential, such as consultation with a physician, communication with allied health professionals, and also the interdisciplinary team meetings. And you also need to highlight the effective communication between the teamwork, with the communication teamwork. So let's assume patient comes with pneumonia, doctor has admitted. You as the first point of contact, probably the doctor has requested for culture and sensitivity tests. Here, collaboration is when you call the laboratory technician or the biomedical scientist. Oh, this patient has been admitted and there's a need for the patient to do culture and sensitivity tests. They say, okay, I'll come and take the sample. Or can you take the sample? I'm busy. Collaboration. So you send it there, and the scientist, the laboratory scientist, also does his culture and sensitivity test. There may be a number of antibiotics that are sensitive to the organism. That is where the pharmacist comes in. These are the sensitive antibiotics. Which of them is available? And the pharmacist will now give you the ones that are available there. So quickly the doctor prescribes, you go for it and administer. That is collaboration. So mostly examiners want to find out whether as you were working on the patient, were you collaborating with other healthcare professionals or you're just doing your own things alone? Now that area that questions can be asked is patient and family education. So the question is, what education did you provide to the patient and their family? Now remember that even before the patient is discharged, you have to visit the patient home. And what is the reason for visiting the home? You want to assess as to whether the environment is conducive for the patient to be discharged. So to answer this question, you need to discuss the key aspect of patient and family education. What are the key? You focus on the topics such as medication management, self-care, signs of complications, and your emphasis should be the importance of patient and patient relative or family involvement in the care, whether the patient is in the hospital or is discharged. So the patient can be educated on the condition so that he will know what brought him or her to the hospital. The patient should be able to be educated on self-care. She should also be educated on the signs of complications so that when he notices any complication, he has to rush back to the hospital. And lastly, when a patient is discharged or still in the hospital, the family, the relatives are supposed to be involved. That is why when you are educating on medication, you involve the significant others so that if he forgets, somebody can remind him or her. In the case of psychiatric patient, when the psychiatric patient is discharged, no family member wants to be involved with the patient. How can that patient recover? So there's a need for family and family involvement. The legal and ethical consideration, most of it are not, we don't have much legal and ethical considerations when you're caring for patients, but sometimes we have. So the question is, were there any ethical or legal consideration in this case? And how did you address them? If there was no ethical and legal consideration, there's no need answering this question. Then there wasn't any. But if there was, then that is where you need to identify the ethical dilemma or the legal considerations you encountered in the care of the patient. Explain how you navigated these issues while upholding professional standards and maintaining patient confidentiality. Patient is diagnosed with stage 4 cancer. He doesn't want you to involve or to tell any of the relatives. How were you able to address this situation? The examiners are waiting for your answers. Now, there's also an area of reflection and continuous improvement. What you did is not the best. Anytime you treat a condition, there is an improvement. So the more you care for patients, the more you improve on your care. So what did you learn from this nursing case study? And how would you approach a similar case in the future? So this is a question that I've asked. Here you need to be very thoughtful because you need to reflect on the experience. You need to acknowledge both the successes and areas of improvement. I won't say weakness, but areas of improvement. And you need to also discuss how the knowledge gain will influence your practice and decision making in the future cases. So now that you have treated a condition like pneumonia, you should be able to treat other patients with pneumonia because you've gained a lot of knowledge in it and how you improve on the deficiencies you encountered whilst you were taking care of this patient. Now let's look at the tips for success. Again, let me emphasize that these questions are not exhaustive. This is just a preview. Some examiners have their own way and their own style of questioning. So please read your case study thoroughly. Try to ask yourself some questions apart from these questions so that when you are asked, you should be able to answer. But again, these are tips for success. If you want to succeed, if you want to pass, then this is the area that you can learn in order to be successful in your Viva Voce. Now, what you need to do first is to be concise, you need to be precise, you need to be organized in your response. Not haphazard response. You go forth and back, confusing the examiners the more. No. You need to be concise, you need to be precise, you need to be organized in your response. Secondly, you need to, the examiners are also professionals. They have worked for some time and they know it all. Okay, not all, but they know it. So you need to use clear and professional language. Please don't be bothered about the jargons, they do it. So be clear, be professional. Now you need to demonstrate critical thinking and clinical reasoning. These are two different things. Questions can be tricky. You need to think critically. But as you think critically and answer, you should provide clinical reasoning. The reason why you are putting the patient in a foulest position, you should be able to give that reason. And you should also provide specific example to support your answers. But if you don't have any example to support, you don't have to bother. Now, you should also be prepared to defend your decisions with evidence-based rationale. Defend, not to argue. Sometimes students think that when questions are being asked, the examiners think it's wrong. So you see candidates arguing. This is not to argue, but to defend. Then you must remain calm. You must remain composed, and you also need to ask for clarification if needed. Please do not answer a question that you have not understood. What you can do is to allow the examiners to repeat the question or to reframe the question. Or you can reframe it and let the examiners check and see if that's exactly what they want you to answer. So did you say that this, and that? I said, yes, that's what I'm asking for. Then you can explain. So in conclusion, what I need you to know is that you need to remember that Viva Voce examinations are aimed to not only assess your knowledge, but it's also the ability to apply that knowledge in a clinical context. So what you need to do is to practice answering these questions, ask feedback, review the nursing case study thoroughly, and enhance your confidence during this oral examination. So read. Know your nursing case study. So thank you very much for your time. And I would say please subscribe to my channel because I'll be dropping a new video on the guide to answering multiple choice questions, so that when I drop it, you'll be able to have access to it. Thank you very much once again.